Shifting to the opposite side?
Yeah, to the right.
Okay, I'm glad you said that. So we're going to change that, okay? So now. My name is Cindy Almonte. I've been a physical therapist for about 22 years. But then in 2016, I became a certified Schroth therapist. So I do treat a handful of other orthopedic injuries, but my primary caseload is now scoliosis, both adolescent and adult scoliosis. Schroth is a three-dimensional exercise approach to developing core strength.
Yes, Piper, this is so good for you.
But it addresses the different planes of motion of the spine.
Excellent. Toes down. Good. Now pull that in. There.
Here, head and neck stays tall. She comes up through here. Pulls her ribs in here and lift up. 1, 2. It's going to be here. So we're going to put the belt in, and your waist is going to be, so here, arms can be here, elbows wide. Grab wide, and we're really going to traction. So nice pull. Feel that traction? I'm going to have you take your feet one more, slightly bar up a little bit. Is that better? Yeah, okay. So same thing for you. If you look at, like, say this spine here, in Schroth, we kind of divide their spines into different blocks, okay? So this top block right here would represent maybe the top half of the cervical spine. So in scoliosis, when you're looking at somebody, when you say it's you sitting looking at me, you will see a curve that maybe looks like this. So you'll see that the block will maybe be shifted this way. And then if we turn you sideways, there might be, part of you might be a little bit more forward or backward bend if you're looking that way. But the third dimension is if you're looking from the top, which you may not see, is the rotation. So with Schroth, we use multiple muscles simultaneously in order to put the spine back together in those 3 dimensions so that you end up in a nice straight block looking at me. This is something called the scoliometer that's just used to measure the amount of rotation. After we take a few measurements, then I begin the treatment of Schroth by starting with a few exercises. There are multiple positions that you can do Schroth in, but in each of these positions, we're always constantly trying to make all corrections in all 3 dimensions all the time. There's a multitude of muscles that we use when we're doing Schroth. So it's not like traditional exercises where most traditional exercises use 1 to 2 dimensions. We actually address all 3 at the same time. With Schroth, there is always a team. It's the most important part of the treatment of scoliosis. There's usually the physician, who is a scoliosis specialist, and then the orthotist. And an orthotist is somebody that is able to make a very good brace that will help with also scoliosis corrections. And now I'm going to bring you back. Tuck your head down a little bit more. That's it. Okay? You'll feel that through the hamstrings. Feel that through there, Amy? Okay? With scoliosis, there's lots of tension through the nervous system. I always integrate functional movements that include Schroth corrections with movements. I do have group classes that you can join. Maximum, the small group, maximum 3 to 4 people, mostly peers the same age. Even though you're in a group, you will perform exercises that are specific to your curve pattern. Lots of stamina. Exhale, elongation. Make your corrections, elbows wide. Hold it. Good. We're going to bring this a little bit more forward. That's the one. Stay tall. Good, even taller. Good, Piper, for 3, 2, that's the one, and put the foot down.